The following is a Carter Media production by Carter Pod. This is episode number 3 of the Featured Business Podcast, and I'm your host, Drew Tully. In this episode, we take another deep look into hospice and palliative care with 2 guests from Shirkey Hospice and Palliative Care. With that, please welcome Clinical Director and Nurse Practitioner Angela Weisz and Social Worker Becky Franklin to the show. Ladies, thanks for joining us. I know we got a lot of information from Chris Brown recently and looking forward to finding out more. In particular, palliative care, that's something that's going to start soon. Can you tell us about that?
Yeah, certainly. Palliative care is the step before hospice. Essentially, you can still be seeking treatment to seek palliative care. And the services that are offered are basically, would include me as a nurse practitioner coming into your home or the facility that you are at, making sure that your symptoms are appropriately managed and that medically you're getting the resources that you need. Just work with the oncologist that takes care of the patient to make sure that the pain's managed and that sort of thing. And then Becky.
I would come into the home or to the facility and provide services to manage the social needs that may be out there. So if a patient's in the home, what can we do to assist them to make life a little bit easier for them, such as maybe housekeeping services, exploring insurance information, Medicaid, Medicare, whatever that may be, or what needs they may be to kind of make life a little bit easier for them. Our palliative program has been a long time coming. We've wanted this for quite a while, and it is really a stepping stone into hospice in the future. But it's that program that allows them to still seek the treatment, but also for those individuals that just aren't ready to bounce into the word hospice. But then they get to kind of know what's going on and how this whole process would work.
And you mentioned it's kind of the start or stepping stone to hospice care. What are the main differences from palliative versus hospice?
I would say the main difference is, say someone with cancer, they could still be seeking chemotherapy or radiation or anything like that. With hospice, you're not seeking treatment any longer. You're just doing symptom management. With palliative, they can still be seeking treatment, and they may come off of palliative. They can be seeking hospice or cancer treatments. And then if their cancer improves and they do well, they can come off of palliative. You don't have to be, it is a terminal, you do have to have a terminal illness. However, we can improve you with the palliative care, honestly, because we're that bridge to make sure that all the separate needs are taken care of besides just that, treating that cancer.
Now, if someone has a loved one or someone they know that maybe needs palliative care, hospice care, is there ever a time it's too early to start exploring options?
No, there's never. When it comes to a need to provide quality of life or just symptom management, no, we suggest contacting us and addressing those issues and seeing what they would qualify for, because it gives the families a peace of mind, and it's just a support system that is much needed during that time frame.
Right, and that's something to think about is the support we offer the families. Sometimes the patient themselves are coping fine and are doing, but those families kind of need that extra support, and that's where we can come in for that also.
Now, I know with anything in life, quality versus quantity is always very key, and that's no exception with hospice and palliative care.
Correct. That's our big thing. It's quality over quantity of life. We make sure that your quality of life is absolutely the best it can be compared to, constantly seeking treatments in and out of the hospital, doing numerous tests, all those things. And we can come in and say, you know what, we're past that. Let's treat your symptoms and make sure that your life is as good as it can be.
We want them to go. Right. That's one thing that we always talk about. A lot of people ask if we're like home health, where, they have to stay home. And we're like, no, we want you to go. We want you to experience life. Sometimes when people say hospice, I look at living, because you're able to go out and live your life the best you can during those, days, months, years, whatever you have, and going and doing that in a controlled symptom way, which is, a lot of times we see patients that come on hospice that have been in and out of hospitals, whatever, get better and are able to do things that they may not have been able to do for years.
And building on that, the What If program seems to go right in hand. That's something that Chris mentioned has really caught my attention the last time we talked.
Yeah, it's a wonderful program. Basically, the emphasis behind it in the name is what if? What if you had one day to do whatever you wanted, or, what would you choose to do? And the surprising thing for us has been it's so simple. Some of the things they choose are just simple things. We've had them go bowling.
Yes.
We've had them go swimming. We've had a couple that wanted to go swimming. And it's just things that you don't think about that these people haven't done in so long and didn't have the means to do it. And frequently it's family get-togethers.
Yes.
Like a last get-together. But we've had some big ones too.
Yeah, we had one large one where the gentleman went skydiving, which was just amazing, and even one of our nurses went along with him, which was amazing. But we've had one that kind of touches my heart. It's where a gentleman wanted to take his wife, and they went back to the church that they were married at. It's just as simple as that, and was able to look at each of the windows on there and tell us the story of of each of those windows, the stained glass windows, so it's something that touches their heart, something that they may have loved to do in the past, or just family time, getting to be there with that family during that time frame. It's a blessing that we're able to do it, right. Which is just, it's amazing to watch the families and to see that each time that we get to do that.
We had the fella went to the MU game and was treated well there, and they kind of made a big deal of him being there, and his family and him enjoyed that tremendously.
Yeah. We've done Chiefs Stadium tour. We've had a gentleman that just loved sports for years, and we had the Casey Wolf come down, and it was just amazing because the glimmer in his eyes was enough to light up a room at that moment. So we have a lady that we're getting ready. Hopefully the weather's great next week. She just wants to go in a Jeep, take the top down, put a scarf on, some Thelma and Louise sunglasses, and she wants to go for a ride. It's the little things, and there's big things that these individuals have just wanted to do in their life, and we want to accommodate as best as we can.
And we're just blessed to be able to do it. It's amazing.
Yeah.
I know in life, hometown is very important for most people, where they're from, where they live. I know that's something that's also important with Shirkey Hospice and Palliative Care.
Yes, we absolutely take pride in what we call our hometown approach. We are nonprofit, so we don't have this big corporation over us telling us what to do from another state. We're able to get together as a team and say, this is what we need to do, need to make happen for this patient, and we make it happen.
Yeah.
It's just completely different. Then it's not about the bottom dollar to us. It's about making sure the patient's quality of life is good.
And we're able to do things that some of the corporates wouldn't be able to do. And the care that, we provide, one of the big things that we do with Shirkey Hospice is at end of life, we actually have a nurse setting with the patient and the families during that process. It's not a social worker. It's not a volunteer. It's actually a nurse that's there with them, letting the family be family, and letting our nurses do that job that they need to do to ensure comfort and peace during that time frame. And that's a big thing.
It is.
And it's amazing to watch, as a social worker, watching our nursing staff step up on those weekends or those nights when, they just what can I do? Where can I be at? What do I need to do? They're not, it may be a weekend and they might want to be going out and doing something, but instead they're taking their time out, their families, whatever, because these families that we bring into our care become our family. We become very close to them. And they step up in just such amazing ways. I can't express what I see. I mean, there's no words to describe when I watch these nurses step up and become, to me, angels on this earth. They're stepping up and being with them.
It is something that sets us apart, I believe, from other hospices. We're one of the only in the area that has a nurse actually sit.
Yes.
And the difference in that is, that's a terrible time for everybody. There is a lot going on. The patients exhibiting symptoms and the families without someone there to tell them what to do, they're not going to know. And we can say, look, you get to be the family. Let us do the caregiving, and we will educate you through this process. And we are not leaving your side until they are at the funeral home. So, we stay with them through that entire process. And it's a nurse.
It is a nurse, yes.
So,
Another point Chris Brown made when we talked earlier was that hospice care is often underutilized. It obviously shouldn't be. What's the best way if anybody has any questions or want to find information before they go or don't go with hospice care? What's the best way to do that?
Right. I would, you could call our number, 660-542-1679. There will be someone on the other end of that phone 24/7. I suggest if you even had the inkling or thought about it, give us a call. If we say you're not really there yet, then that's good for you, because we should be utilized so much sooner. Like she had mentioned before, we have patients that are in and out of the hospital. Your COPD or congestive heart failure patients, they need a lot of management of symptoms. It's usually symptom management. They're back and forth. Where when we're coming into that home, we're seeing it before it gets bad, and we call the doctor and get this done. And that patient's not in and out of the hospital anymore. They're at home with their family, and we improve their quality of life so much. So yes. it's and if you are not seeking treatment and you are tired of going in and out of the hospital, then give us a call. Yeah. That's where we come in.
And a lot of people don't understand all the supports that hospice brings. So not only is there the nursing staff, but we have our CNAs, which is our ladies that go in and care for the showers and, just those daily things, daily personal needs that they may have, which are amazing. And then we have a chaplain in both of our offices, and then social work as well. So we're covering not only the physical needs of a patient, but their spiritual needs, whatever that may be, and their social needs. So we cover a lot more. And then we also have volunteers that come in, which is a great program. Mm-hmm. And one of our favorite volunteer programs right now is bringing in meals. We have some volunteers that make meals, home-cooked meals, for some of our families that are at home, just giving them a little bit of family, a little time, but also for some of those patients that are by themselves at home, giving that home-cooked meal that makes a big difference. It's just a little touch of love,
Yeah, volunteering is a big part of our program. It's actually required by Medicare that we have volunteers. And I think it's kind of, people hear volunteering for hospice, they picture sitting bedside, which is not the case at all. We're the ones sitting bedside.
Yeah.
You're coming in and, like she said, delivering meals, dropping off other things for them, coming in, just talking to them, playing cards with them, spending time with them. So, yeah. So anybody that would be interested in volunteering, reach out to us. We would love to have you.
We love using our volunteers for our What If program.
Yes.
Getting to go out there and experience that with them. And once again, those volunteers become like family as well for these patients.
Well, thank you both for stopping by today and give us more information about Shirkey Hospice and Palliative Care. Any final thoughts before we wrap up?
I don't think, give us a call.
Yeah, give us a call.
The worst we can say is it's not going to work out, and but yeah, we're certainly underutilized and would love to help as many people as we can.
Yes.